Dr Vamsidhar Kedarnath. I am a consultant pediatrician, pediatric intensivist, and allergy and asthma specialist with Lotus Hospitals for Women and Children in Kukatpalli. So today we have a discussion about the vaccinations. I do hope that everyone gets a good idea about it on India on TV. I would like to thank the India on TV to give me this opportunity to discuss about these burning issues as of today. There are a lot of doubts regarding the vaccinations that are supposed to be given to the kids. Usually, the Indian Academy of Pediatrics, which is our governing council, has given a lot of guidelines and modifications since a very long years for us to give the most appropriate and the best benefited vaccination schedule to the children of this country. Vaccination schedules are usually different from country to country. The vaccination schedule are more disease specific and country specific. Every country will have their own vaccination schedule depending upon the demographics and the most common infections and the virulence of infections that every country witnesses it. In India, basically the guidelines for the vaccination schedule are usually published every year by the Indian Academy of Pediatrics. The recent guidelines state that we are supposed to administer the BCG oral polio vaccination and hepatitis B vaccination to the newborn child. Immediately after the birth, the BCG vaccination, which prevents the tuberculosis or rather prevents the complications coming out of tuberculosis, the oral polio and the hepatitis B, which is causative for severe liver problems. These three vaccinations have to be administered to the newborn children at the age of 6 weeks, 10 weeks and 14 weeks. The vaccination schedule which is given at 6, 10 and 14 weeks is the same. Usually the 6 weeks vaccine comprises of the DPT, which is protective against diphtheria, pertussis and tetanus, and recently injectable polio vaccination has been recommended in place of oral polio vaccination. Along with hepatitis B vaccination, the Haemophilus influenza type B vaccination, which is preventive against the brain fevers, and the two new vaccinations that have come and added to the old schedule is the pneumococcal vaccination, which is called as the pneumococcal conjugate vaccination, and the rotavirus vaccination, which is an oral vaccination. So on the whole, at 6 weeks, we are supposed to administer the DPT, IPV, hepatitis B, the Haemophilus influenza B, and pneumococcal and rotavirus vaccinations that are listed as mandatory by the Indian Academy of Pediatrics. At 10 and 14 weeks, we are supposed to give the DPT, hepatitis B, Haemophilus influenza type B, pneumococcal and rotavirus vaccination, omitting the hepatitis B vaccination. The vaccine schedule at the 10 weeks and 14 weeks remains the same. Here, care should be taken to start the rotavirus vaccination as early as 14 weeks and 6 days. Rotavirus vaccination should not be started after the 14 weeks and 6 days, and the schedule should be completed by 8 months of age. Here, to tell you detail about the vaccinations, the DPT is abbreviated as diphtheria, pertussis and tetanus. Diphtheria is one of the most deadliest diseases which is known to affect all major vital organs of the body. Pertussis is nothing but whooping cough. Nowadays, the incidence of whooping cough has come down, but there might be a surgence of whooping cough. So whooping cough is prevented by giving the vaccination of pertussis, which is the P in the DPT. Tetanus, as we all know, is one of the most deadliest and non-treatable diseases. Tetanus is prevented by the T component of DPT. Haemophilus influenza type B is one of the most important causes of under 5 mortality, and it is one of the most important causes of brain fevers in children. Haemophilus influenza type B prevents this infection. And coming to the injectable polio vaccination, in the older versions of the vaccine schedule, oral polio vaccine has been recommended. Nowadays, the injectable polio vaccination, which is found to enhance the immune system of the child, is found to be more effective than the oral polio vaccination. Hence, in the 6, 10 and 14 weeks vaccinations, the oral polio vaccination is replaced by injectable polio vaccinations. Now, according to the recent schedule, the oral polio vaccination should be given at birth, at 9 months and at 6 months. Now, the injectable polio vaccination should be given at 6 weeks, 10 weeks and 14 weeks of ages. Coming to the pneumococcal and rotavirus vaccinations, which are very new and very recently introduced vaccination in the vaccination schedule. Pneumococcal vaccine prevents the most virulent type of pneumonia, which is caused by a bacteria called as pneumococci. This pneumococci not only causes pneumonia but also causes meningitis, which is the brain fever, sinusitis and other invasive septic infections. This prevents the invasive septic infections and also sinusitis and ear infections also in many children who are prone to it. Coming to the rotavirus vaccination, rotavirus diarrhea is found to be one of the most important reasons for diarrheal diseases in less than 1-year-old children. So rotavirus vaccination is also strongly recommended by the standard recommending bodies. Coming to the vaccinations after that, the next vaccination in importance is at 9 months. At 9 months, we do have measles. The measles vaccination was recommended till last year. But this year, according to the recent standard guidelines which are published by the Indian Academy of Pediatrics, the measles vaccine is replaced by MMR vaccination. MMR means mumps, measles and rubella, which are very, very important viral infections and causes long-term side effects. So the MMR vaccine prevents this. Along with MMR, oral polio vaccination is also recommended at 9 months of age. Prior to 9 months, at 6 months, hepatitis B third dose as well as oral polio vaccination has also been recommended to complete the course of the 016 of hepatitis B, also oral polio vaccination. After 9 months, the next important vaccination schedule is given at 12 months of age. It is the hepatitis A vaccination. Hepatitis A is available as 2 vaccine types. One vaccine type, which is the live vaccination, should be given only as 1 dose, and the killed vaccination type should be given as 2 doses. After this, the next vaccine schedule is at 15 months of age. At 15 months, we have to give the booster dose of MMR, or along with that a chicken pox, that is varicella, and the pneumococcal booster dose has to be given. The pneumococcal booster dose, which is already given at 6, 10 and 14 weeks, the booster dose of which should be given at 15 months of age, and the vaccinations that are given at 15 months include MMR, chicken pox or varicella and pneumococcal conjugate vaccination. The next important vaccination schedule is at 18 months of age. At 18 months of age, we have to give the DPT, the diphtheria, tetanus and pertussis vaccination, along with Haemophilus influenza type B. These are the booster doses along with injectable polio vaccination. These vaccinations enhance the booster effect in the child's immune system and prevent for a long term. Next to this, the vaccination schedule is only at 2 years of age. At 2 years, typhoid vaccination should be given. Typhoid vaccination is essential to prevent one of the most important causes of infections above 2 years of age. Typhoid is known to cause a lot of problems in the child, and it is very common and highly prevalent in the Indian subcontinent. Typhoid vaccination again has 2 types. One is the polysaccharide vaccination, one is the conjugate vaccination. Polysaccharide vaccination, when given, it should be followed up with booster doses every 3 years. And the conjugate vaccine of typhoid is usually given at 9 months of age, and second dose of typhoid conjugate vaccination is given at 24 months of age. If the child receives conjugate vaccine, 2 doses are sufficient, one at 10 months and one at 24 months. If the polysaccharide vaccine is given, the first dose of polysaccharide vaccination should be given at 24 months, from then on at every 3-year intervals. Apart from these routine vaccination schedule, there are other optional vaccination schedule. Optional vaccinations are usually given for those children who are having certain problems in the kidneys like nephrotic syndrome, certain asthmatic patients and other patients. So influenza vaccination, or rather I would say in common terms, swine flu vaccination, is a very, very seasonal important vaccination that is usually recommended in swine flu seasons or pre-winter seasons. Giving the vaccination 1 month prior to the onset of swine flu season is a very, very important point to note. Giving a vaccination after starting the swine flu season is not recommended, as the vaccine would take 4 to 8 weeks for the immune system to get enhanced. So the vaccine should be given at least 4 to 6 weeks prior to the onset of winter. So the best recommended time to give influenza vaccination is pre-winter, and the vaccination should be given only between August to October. That is the best time. And in the first year, if the routine vaccination schedule is practiced, 2 doses of influenza vaccination are recommended, followed by 1 dose per annum for 5 years. These vaccination schedule that we have discussed just now is in accordance with the standard protocols which are recommended by the Indian Academy of Pediatrics. There is a lot of confusion between which schedule to follow. So there is one recommendation which is given by the government, and there is one recommendation given by the Indian Academy of Pediatrics. So basically the Indian Academy of Pediatrics is the most important and evidence-based guidelines that they publish every year. Here there are certain set of vaccinations that are called as optional vaccines, and there are certain set of vaccinations that are called as essential vaccines. The difference between the essential vaccines and optional vaccines is purely based upon the cost. So it is recommended that the pediatrician should have a one-on-one discussion with the parents to finalize the most appropriate vaccine schedule for the child. And it is very important on the part of parents to strictly adhere to the vaccination schedule that is recommended by the pediatrician, or else the detrimental effects of these vaccinations far outweigh the risks and far outweigh the benefits that are given for the vaccination. The risk is definitely more after contacting the infection rather than you prevent it with the vaccinations.